Well, let's get more on that by speaking to Jo Poulton, Professor in Mitochondrial Genetics at Oxford University. Good to talk to you. I wanted to get your thoughts on this development, first of all.
Well, it's a great breakthrough. It's wonderful that finally these patients are able to have healthy babies, but it's for a very small minority of the mitochondrial patients where it's actually applicable. In previous years, we thought the group who were doing it felt that it was going to be very widely applicable. They might be having 150 births per year, but actually it's looking as if it's only for quite a small minority of the most severe ones for whom it's applicable.
Why is that the case then?
It's because in mitochondrial disease, usually the mitochondria some of them are damaged, so you have mixtures of mitochondrial DNA, and there's a dosage effect whereby having a high level of damaged mitochondrial DNA gives you a sicker child. There are some disorders where all of the mitochondria are sick, and for those disorders, then this is a really good step forward. But for the ones where there are mixtures of mitochondrial DNA, then there's always a chance that you can actually use the alternative technique of pre-implantation genetic testing to pick a healthy embryo. So the study published is a comparison of the two methods, and it shows that they both do pretty well. But for the most severe patients, it's only the nuclear transfer that works. For patients with the mixtures, then the other one as good or perhaps even better.
Right, I see. And in terms of what work you were doing to advance this even further, what work are you doing at Oxford University?
Well, actually, I'm historically laid the foundations for the theoretical basis for these works that, for when it is that the mitochondrial population of an oocyte is actually formed. So we basically do genetic counselling here, and we pick out patients who are appropriate for the different various treatments.
OK. And there are regulations in the US, for example, I was reading, that would prevent the procedure from being used in America. Correct me if I'm wrong on that, but how widespread might this be used?
Well, it's quite right. I mean, they haven't passed it yet in America. In Australia, they're going to be doing a big clinical study to see how effective it is. And Mary Herbert, the scientist who was at Newcastle, has moved there to head this up. So I think that will be very interesting.
And so what ethical challenges do you think there are with this?
Well, I think that on the whole, there was always the worry that fiddling around with early embryos might result in unexpected defects, and it's reassuring that so far these 8 babies who are born seem pretty healthy. There are a couple of issues which might have been caused by the mitochondrial transfer, but so far the evidence isn't really in that direction. The evidence is largely that these were coincidences. So time will tell as to how effective it is.
OK, Jo Poulton, Professor in Mitochondrial Genetics at the University of Oxford. Thank you very much for sharing your insights there.